So there's two things that you're going to hear about tonight. Primarily, you're going to hear about military innovation and civilian impact. So our focus is to save lives in the battlefield and back home. And in 5 years here, we've been a global leader, working with military scientists, civilian scientists, getting industry leaders engaged as well to move fast. Our main goal is to go from the battlefield to back home, turning military medical gains to better health care for everybody. Everybody through practice changes, policy changes, and bedside solutions that we can use in our hospitals and communities here as well.
I retired as an Air Force general, so in that 40 years plus span, I learned a lot. And I had multiple deployments, including Operation Desert Storm, Desert Shield, Iraq, Afghanistan. I was responsible for the critical care air transport teams. So because of this, I have a special interest in the invisible wound of traumatic brain injuries. And traumatic brain injuries is not just a battlefield injury. 2.8 million Americans suffer a traumatic brain injury every year. Traumatic brain injuries have been misunderstood and poorly treated. And often they've been misdiagnosed as mental health issues. One of the challenges of having an invisible wound, which PTS is one and head injury is I look fine, right? None of you would know that I've had a bad traumatic brain injury. They just know that she's having problem solving, time management issues, cognitive flexibility, learning issues, memory, motivation. So giving new hope to TBI recovery. That's what we do at the Marcus Institute for Brain Health on campus. So at the Marcus Institute for Brain Health, we don't just treat the symptoms. We treat the whole person. Courage takes vulnerability, and you can go from trauma to resiliency. It's okay to ask for help and then take it.
So we'll start with a bit of background of a very important neurological concept and process called top-down, bottom-up. So bottom-up means that the brain, our brains are taking in information. Right now, it's a primal action that seeing something, hearing something, smelling something, you could act immediately. That's part of the brain called the limbic system. However, in a more complex environment, we do have to shoot that up to our newer cortex called the neocortex. And that's where it gets processed at a higher level so we can make better decisions about our actions. But again, remember, it comes with challenges. Many times in a very busy environment, more sensory information over a prolonged period of time, it starts to crowd onto the brain, and that's where we get multisensory flooding. This can occur across many different arenas. What makes that even worse is TBI. But it's that foundation of what's contributing to those that will allow us to design and test more precise therapies for all persons with prior TBI.
What do you do when the toughest warrior, when the toughest soldier, sailor, airman, Marine, guardian, or civilian first responder, what do you do when they say, I don't want to fight anymore? Suicide is now, as you can see here, the leading cause of death among military service members. There's two paths to suicide prevention I'm going to share with you tonight. One is promoting secure home environments, or secure environments in general. We know that delaying access to a firearm for individuals at elevated risk can prevent a tragedy. We're fortunate on campus to have the Firearm Injury Prevention Initiative. This is a national program founded and started here on CU Anschutz's campus to promote secure storage in collaboration with firearm businesses across the US, near military installations. I lead a couple clinical trials. One of them is focused on PTSD prevention. We focus on developing novel treatments for post-traumatic stress disorder, both in our military communities and our first responder communities. Focus on developing novel digital treatments for sleep disturbances, nightmares, insomnia, and problematic anger as well. We also focus on the military families, the psychological health of the entire family unit, because we know that doing so creates not just a stronger military, but a stronger community, including here in Colorado.
My name's Adik Ginde. I'm an emergency medicine physician here on campus at UC Health. So this is a general diagram of science, and science from its beginning, critically important, making discoveries, new treatments, new solutions. We are not fast enough, and not enough of our science actually makes a difference to patient care and patient lives. And that's where the partnership with the military matters, because their questions are now. We are, constantly preparing for the next conflict. Sometimes we are in active conflict. We don't have the luxury of waiting, and nor do our civilian patients. We have really tried to focus on how do we speed this up. So here's one example. So this project, we had a concept in critically ill and injured patients scientifically that we were giving people way too much oxygen. And so with this trial, with our work in airway management, we have been able to influence and change a dozen clinical practice guidelines for the military and the civilian side as well. So we're bringing together our knowledge and content and scientific expertise, our ability to execute, our partnerships around the country and around the world. It's incredibly inspiring to be a part of this work. It's been a great honor. So thank you.